we're live.
Yep.
If you're bored, I always send the same. If you're bored, we're live on Substack. If you're bored, we're live. Here we go. Let's send that here. How's everybody doing? Let's see. Today's my sister's birthday. She's 51.
Happy birthday to your sister.
But she's 3 years younger than me, and I am 54. Oh my God. That's crazy. Can't believe it. 54. Is that crazy?
I was just telling someone yesterday as I've gotten older. I don't know whether I've gotten smarter or my filter is just less present, so I'm able to speak my mind even more. I noticed that when my parents got to be older, it seemed like you would say like, "Oh my God, I can't believe they just said that." But I think that as you get older, you start losing your filter. I don't think
it
as
doesn't matter.
you get closer to death, you care less about saying the truth.
Yeah, that's an interesting perspective. It's really true. I think the filter, it's like, it doesn't matter. You know, a lot of the wisdom that we talk about, it comes from
Yeah, that's for sure. That's for
from
sure.
old stuff. But one of them, one of my favorites is Dr. Seuss. He said, those that mind don't matter, and those who matter don't mind. You know, so whatever you were saying, it's like, if people don't like it, they don't matter. If people
That's a great.
like it, they're the ones that matter. Yeah.
Well, that's going to be good. That's a good segue to start our conversation today, isn't it, Dennis? It's
It really is. Yeah, and it's really interesting conversation. So, you put out an article a couple days or yesterday. It was about, you were talking a couple days ago with a patient who was like, "Why aren't we doing this surgery with a robot?" And you were like, "No way."
Yeah, well, she asked me in clinic, "Do you use it?" Because it's being marketed pretty heavily around us. Not a ton as much as is on the coast. You know, we're in Indianapolis, so we tend to get things later than others. But the robotic technology for hip and knee replacement certainly has been marketed over time. And so it's got about I think nationwide, if you look at the American Joint Replacement Registry in the United States, it's about in knees, it's about a 25% penetration rate right now. So still only 1 in 4 surgeons use it. um, but my post and Substack letter yesterday about the cyber attack on Stryker, who's the largest producer of robotic technology, and just our cautionary tale elicited a lot of emotional responses, and that's not good or bad. I think it is a scary time. My commentary on it, if people would people would read the Substack letter, and that was my comment on some of the comments on LinkedIn. You have to actually read the Substack letter that's got depth to it. And I'm not anti-robot. I'm really pro-patient and pro-surgeon and the relationship between the two. And there's a role for technology, and we'll get into it. But I think what that did was highlight and scare a bunch of, and it should be, right? It's a warning sign, right? I mean, as we embrace anything new in healthcare, at the end of it, there's a patient there. And I think that if we're not honest about it, we took an oath to take care of the patient, and that's front and center. So when you bring technology in, you just got to make sure that it's safe and appropriate. And so when that patient asked me to use a robot to do my knee surgery, my answer, and that was Wednesday in my office, in my clinic, I said, I don't. I use computer navigation, which I do. I'm not unfriendly to technology. As you know, I'm an engineer. I love technology, but I don't use a robot because I use technology to give me what I can't get on my own. I use this to augment. So for knee replacement, the only thing I can't see is the center of the femoral head and a hip. And you need that to get your alignment done to more accurate. But I can see the bones. I can see everything to cut. So I don't need, so I use navigation to guide my placement, but I am okay to use my hands. I always tell people I'm a surgeon. If I can't use my hands, I probably don't have much value. And so that's an important point. So, I got a a text message this morning. I woke up to a text message that said, you need to cool it on LinkedIn. You're making yourself look bad. And that was kind of jarring, right? At first. I mean, I'm a pretty passionate and vocal personality, even in my profession. And so it's not unusual that I don't get some comments like that now and again because I speak out. But I remain convicted on the content of that Substack newsletter that technology has a role, but and what people are not acknowledging, and because I work with companies developing technology and whatnot, I know this is happening, and they're just not wanting to. What I hate is when LinkedIn and social media are great platforms, but I was telling someone yesterday, when I give a lecture in front of 4,000 people, like at the American Association of Knee Surgeons, LinkedIn or social media or Substack, it's like 4,000 people have microphones at the same time, which is both frenetic and chaotic at times, but you have to learn how to navigate it, right? So it's like normally when you have a meeting, people get up in line and they raise their hand and they can talk. Well, social media, it's just like everybody has their own microphone. And so it's a little bit getting used to, but the content of that is a play off of two things that happen sequentially within 24 hours of one another. A patient asked me if I use a robot. I said, no, but I do use navigation, but I don't use a robot. And her response was, good. I don't want a robot doing my surgery. That one comment came from a patient. I'm not lying about it. So people can yell and scream at me all day long if they want. But that patient, she said that to me. It was me and her and my fellow who I train in the room as we were establishing the doctor-patient relationship. And in that and for her, she said, I don't want a robot doing my surgery. Now, there may be people out there who want a robot doing their surgery. No problem. Then go to the 25% of the surgeons in the United States who currently use a robot. And I think that's great. I'm not against the robot. Then what happened was the next day, you wake up to the Stryker cyber attack. And I know people in our area because we're in Indiana is the home of orthopedics for medical device because some of the major companies are here, and everybody's sort of dialed into orthopedics because Warsaw, Indiana is where Zimmer Biomet is and DePuy is. And the refs were saying that the industry representatives were saying that other industry representatives literally woke up to their phones being wiped. They were blank. Right. So, and then I noticed on my LinkedIn post, people were like, well, the robots are working fine. Quit saying that. I'm like, well, I'm not. Yes, the robots were working fine. But what technology is doing right now, because of its massive data requirements, is even everybody is going to a cloud-based ecosystem that they can be shared on servers that are in big data centers elsewhere, because the data capacity is outpacing some of the local servers, right? So if you don't acknowledge where we're doing with technology and going to a cloud-based ecosystem, and that in that cloud, we are vulnerable, right? And my son just graduated from Purdue in cybersecurity, and I'm sure I don't do as well on all of my cybersecurity as he would like me to, but I'm acutely aware, as he studied it for the last 4 years and now works in that field, that it is a real threat. So I think the point of the article was, as we adopt robotics, and now we have a company that has automated robotics, where the hand comes out of where the control comes out of the surgeon. And then we migrate to a cloud-based digital ecosystem that's interconnected. For us to sit there and think that is not a vulnerability is really just not being honest with ourselves. If they can wipe out the industry representatives' phones and the people who claimed this were from Iran, I'm not here to comment on the war or the conflicts going on. That's not what this is. But the commentary is about protecting patients. And I will not apologize for that, ever. I mean, that's just the bottom line. I won't. So, or being an advocate for surgeons. I won't apologize for that either. And if we have different opinion, that's fine. I think you're entitled to that. But if we don't acknowledge the facts of the innovation and deployment of technology in healthcare, and not only the upside and the positive, but also the risk and vulnerabilities, we're not going to do the right service to our patients. And that's the bottom line. And I think that
Yeah,
none of that comes out in the shouting on social media, really. I mean, now I will tell you, even though I got a text that said, "Cool it, you're making yourself look bad on LinkedIn." I had just as many, in fact, probably 10x the number of comments that I got privately, um, you know, through Substack or LinkedIn that said, "I love what you're doing. Keep going. Appreciate that you're uh, being genuine, honest, and pushing." So, you're gonna, when you push and you're gonna speak passionately about things, you're gonna have people who disagree with your opinions, and that's okay. That's the great thing about freedom, and they're entitled to speak it. And social media is just a little bit more chaotic about that. So,
sure is. Yeah, and I think that there's a lot of armchair quarterbacks, armchair surgeons sitting at home with their points of view. But I think that I mean it's been decades, but we've been using robotics for surgery, open heart surgery, all sorts
yeah,
of
yeah,
things.
yeah. Oh, Intuitive is like the original. They're like the OG and they've been doing prostate surgery, general surgery, OB-GYN surgery. Those and those applications for robotics are legitimate. So the prostate, for example, is a very hard to get to anatomical location. So you got to go in deep into the pelvis in a male patient and around organisms and bleeding. And so robotics prevents blood loss. It allows more accurate movement. But the surgeon, and I was watching one the other day in my OR because they were doing a robotic prostate surgery next to me, and you can see the surgeons controlling it from a distance. They're remote, but they're in the room. They're in the corner. You can see the robot. The other thing the robot can do is for obese patients, it can retract. The mechanics can retract the tissues a little better and get way down deeper. I'm all for that. I mean, in fact, I applaud it. That is the deployment of innovation that moves things forward and it's best for patients. It doesn't mean you can't turn your eye away from protecting something that's digitally connected, right? The message is still the same, right?
Yeah.
Now, robotics in knee surgery, and I had a really good mentor at Mayo Clinic where I trained, and Mayo Clinic's got a bunch of robotics, and he told me a conversation. This was 10 years ago when robotics was beginning to be deployed in orthopedics, and it was between him and a urologist at Mayo Clinic, and they were in the lounge, and he said, "Well, hey, I know why we use robotics in urology. It's hard to get places, but," he goes, "Tell me why you're using it in knee replacement, because when you open up the knee is like right there. It's like staring at you. So what are you using it for?" He goes, "It would seem to me it's mostly marketing." And then it's interesting that I had the same 10 years later, I had the same conversations with that urologist I was watching do the surgery here in Indiana. And he said the exact same thing 10 years later. He goes, "Yeah, it seems like a marketing thing for you guys." I was like, "Well," I was like, I said, I mean, and again, I need to find the hip center. So I use computer navigation for that. But that's a very cheap and expensive technology that's been around for 20 years and is validated, but it still works very well for what we need it to. So,
Yeah, and well,
you know,
well, I think that what you're talking about is I think important for every industry right now is that AI, technology, machines, robots, all these things
yep,
are a supplement to our lives, not a substitute for humanness
yep,
inside of any any business model, whether you're writing content or whether you're performing surgery or
yep.
anything in between. These things are supposed to enhance and supplement our lives. And I think the problem comes when they're trying to substitute for the human presence that we're supposed to have, especially in the medical setting. And, I think that something that I've talked about with you before that you are passionate about is like, yeah, maybe the robot can perform some sort of procedure, but it can't console somebody who's scared to death
Yeah,
about.
no, you're right. I mean, one of the things that I talk about a lot, and I feel this uh, emotionally. um, but I am so humbled and feel connected when a patient allows me to treat them in the most vulnerable position that they'll probably ever get into in their life, which is to allow me to open up their body and do the work that needs to be done when they're asleep. That is the most vulnerable position that you can be in. And so I take that so seriously, uh, and I value it and cherish it. I'm just not willing to compromise or turn that over. I'm not willing to turn that over to a machine right now. And that's because I don't think the current generation of my patients want that. Now, will my grandchildren have a different view? Will my grandchildren say, listen, robots are better than humans because maybe they've been programmed to have better ethics, and maybe they've been programmed to, to make sure that they don't drink too much the night before surgery, or maybe they've been programmed to make sure they always make the right decision, or they ask me what my value proposition. Maybe there's a test of value propositions that a automated AI can take of a patient and then make all the perfect decisions. That may be the case. But in 2026, we're not there yet. Right. And so,
So that's interesting. Let's talk about the striker attack. So yesterday, what exactly happened? I know that there was a ton of data wiped out. Did they infiltrate the striker?
yeah,
I
I
mean,
think it was
what
their
I saw,
internal. Yeah, I don't know all the details. I just know what I've read in the Wall Street Journal. That's my only source of of knowledge on this. I can't speak articulate, and I just know the stories from all the reps talk to one another. So some of the reps who must have had company phones, they were wiped. They just
right?
were blank. And I do know that their operating system was infiltrated, and so it shut down operations. Now, it's funny. The other thing I got yesterday too was some people reaching out to say, "Hey, we know you own an ambulatory surgery center, and we expect Stryker's supply chain to be significantly disrupted because they supply so much, like lights, beds, a bunch of supplies." And they're like, "We have a bunch of Stryker stuff if you need it." Like, like with every crisis, the opportunities come come a calling. I
Yeah,
suppose
and
someone could, yeah, and I suppose someone
we're
could
in the
say that
middle
about
of a
me.
war.
Right. Yeah,
Right?
yeah.
Go ahead.
Right. And I suppose someone could say that about me because we're using this we're using this episode to bring attention to something that I think is important. But I mean, I keep going back to the comments that were on my LinkedIn posts as they went all the way down because we commented about it. They're like, my robots were working great today. Like that is insufficient to justify ignoring the warning sign. Right. That's all I'm saying. And I wish and sometimes you can't get all of this out in a written document. That's why it's nice to have this supplement my Substack letter. And I appreciate you asking me to do it because then you can explain yourself even a little bit more verbally, which is I'm not saying don't use robots, and I'm not saying that robots are bad. I'm just saying that this should be a warning sign, and it proves my point again that before we interject, and the title of the Substack is it proves my point. My point is that interjecting AI robotic technology in the doctor or the surgeon patient relationship has to be done very, very carefully and with the patient's needs in mind. So for my example, for what to build on what I was saying earlier, we have to have the patients tell us that they're ready for AI driven automation. We can't, as surgeons, okay, I'm using a robot. Well, did you ask the patient whether they were ready for that yet? Right. And I think that's really the interesting thing. And that patient, when she said that to me, I don't want a robot doing my surgery. That statement comes from down deep, right? That statement comes from wanting the doctor patient relationship in that vulnerable state, right? That's where it comes from. So,
Yeah. So where do you think the future is headed then in terms of finding this balance?
well, so I do think we will deploy robotics increasingly over time. There's never been an industry that once robotics got involved, it backed off. It's my issue is not anti-robot. It is the appropriate deployment and data and evidence driven deployment of robotics. And that's rather than a marketing thing. And then the data comes later eventually. And that's just not what I'm about. And everybody in my profession knows I feel this way, by the way. This is not news to anyone. It's the only people that are getting used to it probably are the expanded audience as I've, started writing on Substack and whatnot. But all of my colleagues know this is the way I feel. I've been asked to debate against the robot for 10 years. So they'll do a pro, at our meetings, they'll do someone who's pro robot, and I'm always the lackey that they have or very frequently the lackey that they have to do the manual instrumentation or not against robotics. But the irony is, what's funny is I've been using computer navigation since 2011. So a decade and a half. So where many of these surgeons were not. So I adopted technologies faster than many of them, but I'm waiting for the data to prove that the next entrance of robotics or even AI is ready for prime time, and I'm willing to subject my patients to that just yet. That's all. Or it's worth the value. Even if you said right now, today in 2026, that robotics and manual are the same, which you could probably say that, except there is some emerging data on infection risk because there's so many more things in the room. Even if you said that they're equivalent, then you have to say, well, okay, a robotic procedure is much more expensive than a traditional one. So if the results are equivalent, why are we subjecting healthcare costs? And where is that coming from? I would rather give that extra money to a pediatric leukemia patient. Like, orthopedics is great and I love it and I'm passionate about it, and making people walk should not be understated. But like my wife and I, we feel a calling to give to pediatric oncology because I don't think there's anything more tragic than a young child with cancer, right? And so I would say, from my viewpoint, this is probably the more, socialist mentality of medicine, and the more, less capitalistic one. Take from the revenues that we should be saving in orthopedics and give it to kids with cancer and that treatment and that research. And we do that. My wife and I give to our local Indiana University pediatric oncology program. And I think that's the message here. It's the deployment of healthcare resources where it's most valuable and where it's most impactful. And I think technology and gene therapy, that's making great strides in cancer. Love it. AI will help us there. Again, this is not an AI talk. It's an appropriate deployment of AI and robotics and automation in healthcare.
So why is it, I'm curious, why is it surgery or a procedure done with AI or technology costs more? Isn't it supposed to reduce costs and make everything more efficient?
Yeah, because we're in the early phases of it. So that's funny. You're like a consumer asking an appropriate, obvious question that us on our side haven't figured out. There's money to be made in orthopedics. Orthopedics is a because it's not necessarily a life or death situation, although it is in the longer term, right? So I always tell my patients, you can do this surgery whenever you want. It's not going to kill you. It's not like you're having a heart attack. But it will kill you slowly if you're immobile and you're not active and your heart and lungs are deteriorating. So orthopedics in general is a little bit more of there's a lot of revenue in it. So companies that make robotics charge for all of that, and hospitals that buy robot systems, those companies get paid for that. And then the hospitals typically use it to market and attract patients. So we have a robot program, more paying patients come to us, right? Please come to us. And so that's really where that's why it costs more. And it does not speed you up. In fact, it's neutral or slows you down. Everybody knows that. They try and say that it doesn't. The heavy robot biased surgeons right now are trying to say that it doesn't cost them time. It can actually save you time now. It's a bit of a stretch in most people's hands.
So then what is the argument that the people are making that are against your point of view? Is it money? Is it
No, it's increased accuracy, right? I mean, that's the legit. I mean, they use it for marketing. That's why if you go on and look online, you'll see surgeon ads, hospital ads everywhere. What you're not going to find is like, oh, the data is so compelling. Otherwise, everyone will use it. I mean, but that's not something that is so compelling and transforms medicine doesn't get rooted at 25% adoption, right? So the argument that the surgeons use is increased accuracy, which it does increase accuracy, but no more than navigation, because navigation does the exact same thing. All these robots, if you think about it simplistically, think it as a two-part system. The coordinates that the robot uses to get its guidance is the traditional navigation system. It's an optical navigation system. You map out the points, the console sits there in the room, and it knows where things are in space. Then the arm, which is called a KUKA arm, it's a standard robotic arm in industry, then it does the cutting. So I'm using my own robotics, this thing that God gave me, and but I'm still using the information to improve its accuracy. That's where the disconnect is. So, and I'm very vocal about the fact that that's great. A robot is more accurate, yes, but I'm I'm getting compensated for the work that I do in that surgery. Why are we interjecting another entity to take another piece of that pie when I'm the one doing it already? Right. And what I keep telling the younger surgeons is just be careful. This is God's honest truth. This week, another thing I got was a industry person asking me about automated robotics and RVUs, which are called relative value units. That's how we get paid, being attributed to automated robotics, because that needs to be compensated. And they're worried that when that happens, they're going to start taking the compensation away from the surgeons.
All money.
Who's doing the work?
Right.
Is the robot doing the work, or is the surgeon doing the work? Right.
Interesting.
Again, this is a complicated matter, but it's emerging fast. I was looking at some stuff on Substack before our call, and there was AI in other industries. The conversation is AI is moving faster than humans. And someone commented that one of the issues is there's a gap in that speed of adoption, right? And I think probably that's just the human conscious and ethos just progressing a little bit more cautiously, because AI is moving faster than humans are capable. That's okay. But I do worry we have to discuss these issues. And I know everybody just wants to say AI run. Yeah, great. Awesome. It's going to replace, it's going to make us all better. That is, in my opinion, that's very naive. And I just think we have to have these honest conversations. And if people are unwilling to, that's fine. Tune out, turn off the Substack. Don't look at my LinkedIn page. The great thing about freedom is you don't have to scroll. Like, just stop. Stop. Or if you disagree, that's fine too. Speak up and then be ready for a rebuttal. But honest conversation is the only way we move things forward, in my opinion. But I do. If we're going to start talking, we should be honest with each other and have data and science drive the innovation rather than. And capitalism is always going to be a part of our society, Dennis. You know that. I know that.
Yeah,
And
of course.
that's a good thing. But capitalism without ethics is totally different. That's why the banks periodically the banks get in trouble, right? And they have to get regulated. They wouldn't have to get regulated if they regulated themselves with their own, but greed is a powerful thing, right? So it's just regulating all of that. But we have to have these conversations about AI and automation, and I'm going to be right in the middle of it. And and I'll have my opinions, other people have their opinions.
So then, why is it that so many people are pushing back against your opinions? Do you think it's because
I think they're the one. I think something happened yesterday. I think, look, if you look at human psychology and human behavior, when people get scared, nervous, or threatened, some of them can lash out. And so that striker attack was a legitimate concern. I mean, how can you not? It's a medical company, and there have been multiple cyber attacks, and more in the last 5 years targeting healthcare, which is 20%. You and I have talked about this. It's 20% of our GDP in the United States. So if a country, if a country who we're at war with wants to hit us, they can hit that industry. We're a target, whether we like it or not. And so I think that what happened Wednesday, it was Wednesday it happened, I think, or was it yesterday?
Wednesday.
No, it was Wednesday. I think it was Wednesday when it happened. It scared people, and that's appropriate. And so what we did, was we said, oh, wait a minute, because what we talk about all the time is robotics. And I know that increasingly the developers and surgeons are talking about bringing this ecosystem to a cloud-based interconnected model because they're saying the data doesn't have much value sitting in its little place on the robot. And then all of a sudden, it doesn't take a rocket scientist to figure out if Stryker gets hacked at their corporate level and everybody's asking for the robot to be more interconnected. It doesn't take a rocket scientist to be like, whoa, like that, right? But I think people got scared. And when people get scared, and that's okay, they lash out. So I think that the lashing out on that part, and I've been a vocal, uh, again, I get part of it is my reputation for speaking about the appropriate adoption and deployment of robotic technology, and it's not there yet, right? So I'm seen as quote unquote, it's easy to just say I'm anti-robot. That's not what I am if people bother to take a deeper look. But I think people were scared, and that's okay. They're threatened. And the people that lashed out at me were all robotic users.
Right, of
And
course, yeah.
and that's okay, right? They're like, my robot was fine. It was doing fine. I'm like, that's not my point. I wasn't saying, if you listen, it wasn't my point that your robot did fine during the cyber attack. My point is that a cyber attack on healthcare is a wake up call. That's all.
And so what is the balance then between, between you where you stand and where other people
Where
are?
they
What do
are.
you think is the balance? Like, what is
It's the
it?
appropriate adoption. And so I think if we're going to start connecting if we're going to connect the patient level technology that's literally right on the patient, like in their body, in the case of a robot, you have to spend probably 10x on the cybersecurity than you do on the actual technology to protect the patient. But in these conversations, I hear no one talking about cybersecurity. Now, maybe my brother is in cybersecurity, my son is cybersecurity, so maybe I'm a little more sensitive to it. But that hack and that attack, it kind of proved my point, right?
Yeah, it did.
So I don't hear anyone in any of these meetings I'm in talking about robotics. I don't hear anyone talking about cybersecurity. Never, ever. And I'm in the meetings. I think we ought to start talking about it. And
But I think it's such a huge topic. Security is a huge topic, but is it being addressed enough or in the right ways? Right.
right. So I think that's where the bridge is, right? I'm not saying don't use a robot. I'm saying protect the patient. And then we can all discuss how we bridge that.
Yeah,
Uh,
patient first. Always patient first,
Always.
right?
It's the oath we took. First, the oath we took, the sort of the summary bullet point you hear frequently is first do no harm, right? That's the basis of the Hippocratic oath, which is now called the physician's oath, but it is it is it is the premise. So someone asked on the chat, I can see if they hit the medical industry, it's bad. Um, and it's that, yeah. And so how do we prepare without slowing down progress? I think it's investing. The progress will have to slow a little bit because we have to deploy, however many X resources on the cybersecurity as we go, right? I always think about most of life in like some of those old war movies, right? I used to talk about like when you're protecting them, like we have to march into the battlefield maybe a little bit slower with some scouts up ahead, right? We can't just run onto the battlefield, right? So you got to do the work. We got to invest in cybersecurity probably ahead of the innovation, and then the innovation has to go right. But if you don't protect the technology and innovation deployment first, then that becomes vulnerable. And I think that's what I think that's what the warning shot was. Like, we're vulnerable, right? If they can get into Stryker, they're the number one knee company in the United States. They just passed Zimmer Biomet, which is great. They're a great company. This is not an anti-Stryker thing. I was a consultant for them for 10 years. They are a fabulous company. This is a healthcare industry wake up call, in my opinion.
Now,
And look,
did this affect you at all?
no,
You and your business at all?
no, we have a lot of Stryker stuff in our ambulatory surgery center. We have Stryker lights, Stryker beds. We have a lot of Stryker, but at least not yet. Now, if what people are saying, if it hits their supply chain, then we might start seeing it next week because we're already, always ordering supplies for the for the surgery center. Um, and so that could impact us. I don't know, but
Right,
We'll
but from a technical standpoint, like, you have security in place and you're using, uh, whatever
Yeah, so
technology.
yeah. So I'm a consultant with a company called Health Outcomes Performance Company, or HOPCO, and they do all of our digitally integrated IT solutions. So our infrastructure has full cybersecurity protection, but it doesn't mean, remember, as it has cybersecurity protection doesn't mean it's, doesn't mean it's impenetrable, but we have protection. But during our surgeries, the actual surgeries, we use non-connected computer navigation that's not connected to an external. Um, and after Wednesday, I will continue on that way until I have confidence that anything that's connected into the patient is not connected externally. That was
Right,
my,
and
I
I
mean,
think
that's what I took from it.
yeah, and I just learned earlier, I was doing a little more research about it too with somebody, and I learned about that. It's like when you're using any type of machine or instrument or technology that's being used in a procedure in a human being, it's not connected to
Not right
outside.
now. Not right now. But I can tell you the talks are about connecting. And that's what I'm saying, because these machines are collecting data, as in orthopedics, they're collecting data. And so where does that data go? Right now, I would say that after the procedure is done, then it can upload the data. But increasingly, the right now we keep that data in the device. We don't ever send it anywhere. But increasingly, they're asking for the interconnectivity of the patient journey to be all connected. And again, I think that's where I think that's just where we have to be careful. And so
Interesting.
current state, that's why all the robots that were in patients were fine, right? Wednesday, they were fine. That's what everybody was yelling at me about. No, they're fine. They're fine. Yeah, I hear you. I know they were fine. I'm, yes, I know. But that wasn't my point. My point is it's a vulnerability. And
Yeah, sure.
as we continue the innovation adoption, it would be I would say, more than just wise. I would say it's mandatory that we invest in the protection of the innovation and the protection of the deployment of technology rather than just the technology itself. Otherwise, it's reckless innovation, in my
Yeah,
opinion.
yeah, which is there's a lot of because it's all money
Oh,
driven.
yeah. Yeah, but in healthcare, you can't. This is the problem. That's why the FDA exists, right? That's exactly why the FDA exists, to protect patients from reckless innovation, right? So I suspect, knowing what I do and spending, in fact, early next week, I was supposed to be in Washington D.C. with the American Association of Hip and Knee Surgeons, but I have to be in Milan for a development meeting. Um, Working on implant design, but I couldn't make the Washington meeting. But I suspect that the FDA and CMS are acutely aware and discussing the cyber attack. I mean,
Of course.
how could they not be, right? I mean,
Yeah,
that's
the whole world is.
yeah, right. Right. I mean, they're not the only healthcare company in the world that is involved in treatment of patients surgically. And,
Mhm.
it's just a reality of our world. So I just want to have open and honest, frank discussions about deployment of innovation and robotics and automation and AI. That's what we're all about.
So, something you said maybe a little while ago, like 20 minutes ago, that interested me. You said that there was a higher risk or at least possibility of infection.
Mhm.
Uh,
Yeah, that's there's a report out of the New Zealand registry years ago, a few years ago, that I would use. I know all this data because, of course, when I have to argue again, when they ask me to argue against robotics, I pull all the data that I can, you know, from it. Um, so there's a registry data that showed um, a twice greater infection rate in robotic partial knee replacements over than total. That's in the peer reviewed literature. That's a fact. That data exists. So I'm not disparaging robotics. And what we are trying to understand is whether that is going to continue to be extrapolated now that we do it more in total hip replacement, whether that comes to fruition. And there's a whole lot of theories that registry data doesn't establish causation. It only establishes correlation. So it can draw a correlation from the data, but it can't say here's why, etc. So The causation remains unclear. There's a lot of theories about it. When you add, when we're doing surgery, it's a sterile field. And so, we have all these techniques that have been developed over 50 years, 60 years 100 years of surgical evolution. But then you introduce a mechanical device that's in there with you that has to be covered and gowned and draped, like another human. And then you have extra pins that are going in. So it adds another layer to it of complexity. And my contention is that probably it may be a sterile field issue. Now, other people, the operative times are longer for robotics cases as well, typically. Not all cases, but typically. There's very strong data, very, very strong data, that longer surgical times equal higher infection rate. So my theory, and their theories, I don't have the data to prove it, but is that either longer operative times and or the complexity of additional things in the operating room that can create a less sterile environment are the reasons why that correlative data exists.
Yeah, you wrote a research article on that.
I did.
About how why would you have a two-stage process if there's a one?
Oh yeah. That's my one stage versus two stage. For chronic infection and hip and knee replacements. Yeah, I've been passionate about that as well. That's also another thing about just deployment of tech. It's, I would say, a surgical technique before the data is really robust enough. Yeah,
right. And there's another question from Peter. Air gapping, air gapping in the medical industry is great. It will also help us develop med tech for space travel.
I don't even know what air gapping is.
I think it's using different. You were talking about it, using a different power source or using different connections than to the bigger thing for the operation or the procedure at hand. Is that correct?
I don't know. Peter would have to answer that. I'm not sure. I'm not familiar with the term air gapping.
Right. So he says, air gapping is not connecting the tech.
Okay. Yeah. Yeah. That's the term I was describing. Now I have the name for it. Thank you, Peter. Yeah.
The question is, do you think a large investment in air gapping med tech would help build trust, safety, and patient confidence? Do you think the investment is worth it?
Yeah, I think that plus cybersecurity. I think both of those. Yeah. I mean, everything.
You're doing that right now.
Yeah. Yeah, that's right. Yeah, I'm air gapping. I didn't know it, but it's great. Thank you, Peter. That's good. Yes. Yeah, we don't connect ours to the internet. Yeah, that's a great point.
Yeah. So then,
yes.
Yeah, so that's great. And so it sounds to me like, what kind of recovery time do you think that the Stryker thing is going to take? Do you think that
I don't know. I just looked up on Wall Street this morning, Wall Street Journal, about the only article I could find was 17 hours ago, or it's probably 18 hours ago now. And it said that they're still facing disruptions, but it didn't really go into I didn't really dive into what disruptions they're still facing. But
yeah, sure. And then how does it affect you? How does it affect the trust? Do you think that there's patients or people out there that are losing trust? Well, I think a lot of people have lost trust in the healthcare system, but are losing trust.
We've talked about that before too. That's a whole nother concept. But.
It is. I mean, it's almost like you could take like your stance on things and keeping the humanness in the technology for a platform, as a platform to stand on with the Indiana Orthopedic Institute and yourself. And do you think that people taking just robotics, they're using it as a marketing stance? You're saying that they are robotics driven organization?
Yeah, there's no doubt there's a very large marketing component to robotics. There's no doubt about it. And if anyone denies that, they're lying. I mean, so that's just an honest truth. And any executive would agree with it. Any surgeon would agree with that. Now, how much they use it for marketing, that's a separate issue. And the younger generations, it's not going away. The younger generations are more adept at it. Like they're coming out trained on it. They feel like they need it to do a better surgery. And there's a whole host of reasons for that that are probably beyond our. You're wanting to dive into it.
It's really interesting. It made me think about, like, I'm a scuba diver and I started diving like 25. What is this? It was like 25 years ago. I started diving And it
Yep.
was right on the cusp of when computers started coming out, the dive computers. And before that, like, we had to, I mean, you have to get certified to do dives anyway, but back then it was like we studied the charts, we learned about surface time, we had a submersible pressure gauge, we had to know everything about the science behind it
Right.
so you don't die when you're down
Right.
there. Learn about nitrogen narcosis and
Yeah.
all these things. And now everything you need is on the computers, and the computers don't fail. Like, they never fail. Most of the time you're diving with people, and so you're trained on how to survive and use other people's air and stuff like that.
Yeah.
But, like, I'm curious,
It's a good
since it's
analogy.
cool. I mean, like, what we're saying is, like, they're coming out trained on the technology, but is there a gap in other information they need to know about biology to use your hands in case the technology fails?
Yeah, so you hit the nail on the head, Dennis. We are discussing that on a daily basis inside the profession, which is has there been a gap that's been created? I your analogy is perfect, by the way, and I like to use the airline industry. I've throughout my career, I frequently look at advances in airline technology as it relates to surgical, both education and performance. The reason is because you spend a number of hours in a flight simulator before you get in a plane. And then you see the younger surgeons are flying a plane with 6 people in it. So if it happens to crash, it's not catastrophic. You get on a 747, you realize the pilots have a lot of gray hair, right? You just know that they are, right? They've a lot of hours, their experience. And I go back to the Sully Sullenberger landing on the Hudson River. If a robot can do that, great, right? Right. So engine goes down, robot can do everything. And it probably in the future probably can, right? But for right now, there's probably a little bit of a gap between technology on an airplane and what Sully Sullenberger can do. So we've got to bridge that gap somehow. When I get on a plane right now, I look at the pilots. I still don't have the confidence enough that that airplane can fly itself,
Sure.
right? Right. And so surgeons are the same. We're the pilots of the operating room to some degree, and so that's a really good analogy. So our training, what's happening right now, and we don't know the answer to this. There are surgeons that are coming out of training and saying, I have to have a robot to do a good surgery.
Yeah.
I didn't have a robot when I came out. So I have the skills that if I'm in the operating room, a robot goes down, I'm good, right? If I was having to use a robot. I interview fellows because I train fellows. So I interview orthopedic residents. And the last couple of years, they've been saying they are looking for fellowship programs that don't have a lot of robotics in it. And I said, why? Because we don't have a lot of robotics in ours. They're like, because I haven't done many surgeries without it. And I'm scared that I either go to a hospital that can't afford it or that it's going to go down. And we've actually heard a couple stories where a robot went down and the surgeon, like either before the cases, they just canceled the surgeries because they didn't know how to do the surgery without the robot. But that's fine. But if you're a patient, you carved out your whole life to get ready for your knee replacement, and your surgeon says, sorry, we got to reschedule it. Sorry, you got your family took off work. Sorry, you got your whole house in order to have this surgery. We got to cancel it because the robot went down. Okay, that's fine. It's an inconvenience. The worst case I've heard is the robot went down in the middle of the surgery and the surgeon couldn't complete the surgery.
And you've heard of that, and you're seeing that.
One
Have you
time.
seen it one time?
One time that I know of, that a resident applicant said that it happened in their residency program.
And so what happened? They just close you up, and then you're damaged, or
I don't think I even wanted to know the rest of that story, but yeah, that's a catastrophic error, right? So again, I live and breathe orthopedics, as you know, and I've been an educator and a researcher for a long time. So those sort of things are impactful to me as I try and move the profession forward with all my colleagues and all the other orthopedic surgeons. Events like that are I feel really bad for the patient, right? And so I think that's why when the whole, I don't know, some people are mad, but again, I think they're scared. To go back to the original question, Dennis, about why people are lashing out about drawing the connection of dots between automated robotics, which has been huge in the last few months because the largest implant company in the world acquired a fully autonomous robot. digital AI adoption, and then cloud-based interconnectivity. I don't think it takes a lot to realize those dots are connecting and converging somewhat quickly. And I'm just advocating for patients and for surgeons and that relationship along the way. That's the main thing.
Yeah, and I love that. I mean, like, it's hard to find a fully ethical person nowadays. But this last question is really interesting also. He says Peter says, "Michael, my biggest concern with AI and
Yeah.
robotics is innocent
Yeah,
liability."
that's a great question, Peter, and I'll give you a perspective. I know we don't have much time left, but I was having a conversation 2 months ago with one of my colleagues, who's at a major academic university on the East Coast, and he said they just had a lecturer come in about medical liability and AI and where the liability occurs. Because it's not far fetched to suddenly say, "Well, the AI made that decision. I'm as I can't be sued." Well, and so it become all of a sudden, and people are going to want to know this the most and the fastest are the lawyers, of course, but the physicians also need to know it. And it turns out that what they said, the leading thoughts around this, I don't think it's been fully baked yet, is that the companies that produce the AI will be liable. Now, that changes the paradigm. And what I tell people is, all right, what I tell physicians is be careful if you want to give up that responsibility. And they may be like, oh, yeah, great. I'm not liable anymore. Let AI be liable. Just remember the path of least resistance in life isn't always the best. And as soon as you give up your accountability, you're probably going to get paid a hell of a lot less. So
And
that's fine. It is what it is, but that's the path. That's the easy button, right? Okay. Yeah. Let's let AI think through it. That hurts me to go through that, disease process in my head. Let's let AI figure it out. Okay. And AI is liable. Great. Pretty soon, what are you doing? I mean, what are they going to teach in med school? And as you know, you and I've covered this topic of Elon Musk saying surgeons are going to be obsolete in 3 years. We're not even talking about there's this battle that goes on where inside medicine, where the surgical specialists are referred to as the non-cognitive specialists. It's basically a way for all the other physicians who aren't surgeons to insult us by saying we don't think, and they're the cognitive specialist. If I were, I would be terrified about AI if I were a cognitive specialist. Terrified.
interesting.
Right?
So do you think that though that the companies, the AI companies, the software, whatever tech companies, they're gonna put like because they have lawyers too. So they're gonna have things in place that you can't use our AI technology
Oh
without
yeah.
you have to
Well,
release liability.
these AI companies have so much more wealth than even the biggest hospitals do, right? So, in all fairness, look at these AI developers running around the country, running around the world, going to China, getting multi-billion-dollar investments for AI. I think it's safe to say we know where the money's going. And what recently, I think it's like the 5 tech companies drive the entire Wall Street earnings. So I don't think it's hard to see where the money and the cash are going. So they're probably going to get the liability whether they like it or not, and they probably deserve it because they're also going to be powering a lot of the decision making. So I
Well,
don't
it's
have.
interesting, yeah, because what you're saying is basically like when they introduce a new drug or a pill, big pharma, they make $100 billion, and then they already have budgets set aside for lawsuits.
Oh
It's like,
yeah,
"Oh, we're gonna lose $5 billion on this lawsuit, but we're gonna make 100 billion, so who cares?" Or even if
yeah,
they lose 20 billion,
yeah. The term I hear used for that, it's the cost of doing business,
the
right?
cost of doing business. Yeah,
It's embedded. If you're in pharmaceuticals, that's part of the cost of doing business. Paying
yeah,
for paying for large randomized controlled trials, paying for paying for the lawsuits and et cetera. So yeah, that's I think that's
interesting.
probably embedded in it. So I'm sure AI is not. I'm sure they're talking about it more than and probably way ahead of when we were talking about it. So
Yeah,
pay.
because it's such a huge thing. I mean, like, they already have that built into the budget. They have lawsuits and everything
I'm
built
sure.
in.
I'm
Yeah.
sure. I don't know for sure, but I would suspect that you're exactly right. But they would have to, right? If they're going to be accepting the responsibility.
Yeah, but then we're talking about and always ethics should always be part of the equation, but there's a difference between the AI company and the doctors cutting human beings open, right?
Yeah, yeah. Yeah,
Even though ethics should be present everywhere, they're not,
yeah.
just speaking honest, frankly and honestly. So, so that's really interesting. So, yeah, awesome. Any closing arguments? Any last words? Peter, did we answer your question?
Hope
Uh,
so.
Anybody else out there? And so what's the best message? I think the takeaway that people should have who are tuned into that striker cyber attack, the hack, like what do you think uh, that people should do? Because you're very human centric, you're
Mm,
very focused on the patient,
yeah,
and that's great. Is like, what do you think somebody who's looking for a knee or hip replacement or any medical
yeah.
person, like what do you think they should be
I
looking?
think the good news is in this particular case, not that I can see directly or whatever, there was no patients harmed by this. Great. So I think in some respects, it is an appropriate warning sign in the development of automated technology and innovation that we just have to pay attention to. And I appreciate you giving me an hour to clarify my newsletter and speak so that hopefully people will tune in and understand the depth of what we're really talking about here. But it's not anti-robot, it's not anti-innovation, it's not anti-tech, it's even not anti-artificial intelligence. It is just keeping patient safety and appropriateness and ethics right along next to you along the journey of innovation, and then putting protections in front, like cybersecurity, investing just as much in cybersecurity as we're doing in all the other innovation. And I think that could that slow, to Peter's original point, could that slow down innovation a little bit? Yes, but that probably means it should be slowed down just a little bit, right? I
Absolutely.
mean, all innovation isn't perfect innovation. So maybe we were going too fast, and maybe we need to so check the brakes, a little bit. We're getting a little out of control. We've all done that in our lives. We're getting a little too fast. Let's slow it down. That's all. So, but I
Yeah.
appreciate you giving me a chance to talk about it, Dennis. It was great as always. You're a great interviewer and always a great time to share thoughts with you. And appreciate you
Yeah, and
listening.
thank you too. I appreciate that. And thanks everybody for tuning in. If you have any questions, please ask. If not, tune in. Maybe we'll be back next week. I'm not sure. Or soon.
I'm in Milan next week. It won't be next week. I'm in Italy working on a next worldwide knee system that we're launching. So I'll be
Oh,
up.
awesome. I can't wait to hear about that. We're going to Miami for the Miami Open
Oh,
tomorrow,
awesome.
actually, for a few
Safe
days.
travels. That's awesome. That's great. Good for you.
Yeah, I'm excited. Awesome. Well, nice to see you. We'll talk again soon. Bye, everybody. Have a great day.
Thanks, everybody. Thanks, Dennis.
Peace.